So to manage pre-eclampsia, you're still going to use the SchrDbb algorithm. You're going to first manage the disease. To manage the disease, you use a principle of management. So actually, the goals of management is relieve the symptom by treating the mechanism of the disease. The second thing is to treat the cause, but there is no cause in pre-eclampsia. The next is treat the complication. The next is to evaluate for to prevent the occurrence by treating the background. And the last one is a follow-up. So now the first thing is to first treating the mechanism of the disease. To relieve the symptom by treating the mechanism of the disease. To treat the mechanism of the disease, we now use the principles of management. So the principle of management of eclampsia is there are 5 steps in the principle of management of eclampsia. The first is to admit the patient. Is admission. So that's the first step. The second step in evaluating for preeclampsia is antihypertensives. The third step in the management is going to be prevent convulsion. The fourth step in the management is stop convulsion. Provided that the patient already has eclampsia, stop convulsion. And then the fifth step is delivery. So delivery, and then the last step is freeze. So for the admission is not even there. So those are the 5 major steps. The first step, antihypertensive. Second step, prevent convulsion. Third step is to stop convulsion. So it is preventing and stopping convulsion, or third step is to stop convulsion. The fourth step is delivery, and the fifth step is freeze. So those are the 5 major steps I have to evaluate. So now the end step should be delivery, and this is the most important. The most important step in the management of the patient with preeclampsia is that you must deliver the patient, provided that the patient is having severe preeclampsia or the patient is having eclampsia. Severe preeclampsia or eclampsia. So those are the elements I need to visualize. Now let's start. Every time that you have a patient that has preeclampsia, now there are 2 major things that is important for you in the management. There are 2 major things that is important for you in the management. The first thing is to know the gestational age. The gestational age is important for you in the management. And the second thing is to know the severity. Now the severity first is the most important. Now, when you have a patient that has a mild preeclampsia, if you have a patient with a mild preeclampsia, you need to know that generally the simple management is bed rest and monitoring. So you do nothing apart from doing a patient. You do the patient do bed rest and monitoring for mild preeclampsia. Now, the next one is a patient with severe preeclampsia. Every time you see a patient with severe preeclampsia, you should deliver. Because the patient may go up to eclampsia, and eclampsia has a very high mortality rate. So in how long you should deliver? You should deliver that patient within 12 hours emergently. So it means that this is why a preeclampsia is not an absolute indication for cesarean section, because if the patient was already at 4 centimeter dilatation and you evaluate that the patient is increasing by 1 centimeter per hour, it means that she can deliver per vaginally within those 12 hours. So that's why if the patient always have a good Bishop score, there is no need for you to go and do cesarean section. So you have to deliver within the 12 hours. Now what happens is, what is going to occur within the 12 hours is very important. Now the next thing is, if you have a patient that has eclampsia, the patient has convulsed already once, you have to deliver that patient within 8 hours. The question is, what do you have to do within that 8 hours? So those are the different elements you have to do. Now, every time you have mild preeclampsia, just bed rest and monitoring. But you have to evaluate, before doing bed rest and monitoring, evaluate for the gestational age. If the gestational age is less than 34 weeks, and it's more than 28 weeks, you need to mature the lungs. You need to mature the lungs. Now the question is, how do you mature the lungs? You either use beta-metazone, and it is beta-metazone 12 milligram one time 12 milligram to 24 hours for 2 days. You give 12 milligram. It is IV or IM, but in our context we use it IV. Is it clear? So betamethasone IV or IM 12 milligram every 24 hours for 2 days, or you use dexamethasone if you don't have betamethasone. Dexamethasone, it is 6 milligrams IV 2 times per day for 2 days. Is it clear? 6 milligram IV 2 times per day for 2 days. You do a long maturation and then you wait for the patient till 34 weeks of gestation and you deliver. But if the patient is already more than 34 weeks of gestation, you confirm the gestational age and then you deliver the patient. Is it clear? So those are the different elements that you have to assess for mild preeclampsia. Now for severe preeclampsia, you have to deliver within those 12 hours, and for eclampsia, you have to deliver within 8 hours. Now, within those 12 and 8 hours, you need now to do these other elements. You need to give the patient antihypertensive. You need to prevent convulsion in the patient. You need to stop convulsion. You need to deliver the patient. You need to give fluids. So those are the different elements that you have to put when you have a patient has severe preeclampsia. In mild preeclampsia, you just need bed rest, and sometimes you just need to give antihypertensive to the patient to prevent that the diastolic blood pressure goes above 100. Their goal is that your diastolic blood pressure should be less than 110. The diastolic and not the systolic. Diastolic should be less than 110 millimeters of mercury, because that's a major sign of severity. Is it clear? So that's the major goal when you give antihypertensive to the patient. Is it clear? So you give oral antihypertensive to the patient so that the blood pressure should be less than 110 millimeters of mercury. So the next thing is to prevent convulsion. Preventing convulsion and stopping convulsion with fluids is also required in the patient with preeclampsia, but all these other ones are required when you have a severe preeclampsia. So now, what are the elements that you now need to do in the order? So let's start with antihypertensives. Basically, every time you have a patient that has a blood pressure of less than 110 millimeters of mercury, a diastolic blood pressure, basically, when the diastolic blood pressure is less than 110 millimeters of mercury, you give methyl dopa. Methyl dopa is the best that is being given. It is a central antihypertensive, central acting antihypertensive, methyl dopa. Basically, it is given from 500 milligram to 2000 milligram per day. Basically, so one tablet daily is given from 500 milligram to 2000 milligram per day. You give methyl dopa. Now, when the diastolic blood pressure instead is more than 110 millimeters of mercury, now it's an emergency in the case of severe preeclampsia. In this case, you can use a calcium ion channel blocker. You can use, the first one is nicardipine. Nicardipine 20 milligram. So how do you use a nicardipine 20 milligram? You use nicardipine 20 milligram, 1 ampoule in 9 mils of normal saline. 1 ampoule in 9 mils of normal saline. You inject it 1 time every 15 minutes for 1 hour. You inject it 1 time every 15 minutes for 1 hour. Or you can still put 4 ampoules of nicardipine 20 milligram in 1 normal saline, and then you start at 8 drops per minute. Then you increase by 4 drops per minute every 15 minutes until the blood pressure should be maintained below 110 millimeters of mercury. Is it clear? So those are the different elements. Or their target set point is generally less than 25% reduction. You have to reduce the blood pressure by 25%.